seen those crazy weight loss trends that are advertised all over the internet and TV saying, how to lose 15 pounds in 15 days, or dietitians will hate you for knowing this weight loss secret. We are here to put all of these ads to a stop right now. We have discovered the quickest and easiest way to lose 15% of your body weight without diet or exercise. I'm serious. All you have to do is embrace your inner Hannibal Lecter and skin yourself, as your skin is roughly 15% of your body weight. But seriously, don't do that though. You'll die. The skin, also known as the integumentary system, is the largest, fastest growing organ in the body. It holds fluids in, keeps harmful microbes out, balances your body's temperature, and even plays a crucial role in vitamin D production through sun exposure. There's no doubt that it is one of the most important organs in your body. It is primarily comprised of three main layers: the epidermis, dermis, and hypodermis. In itself, the epidermis is made up of 7 layers. Unfortunately, there are many conditions that can affect your skin's health. One example is eczema, a disorder that causes your skin to become red, itchy, flaky, and scaly. What's interesting about eczema is that it is more common today than it has been ever before. Eczema, specifically atopic dermatitis, is the result of constantly scratching your skin, leading to open sores that can possibly introduce some detrimental infections. Since about 1970, diagnosed cases have gone up about 150% in the US alone. There are roughly 3 million cases today in the US. Eczema is triggered by a wide variety of things, ranging from soaps and detergents, sweat, jewelry, cosmetics, clothing, temperature changes, stress, and even allergens. Treatment varies from lifestyle changes to application of topical steroids to calm down the need to itch your skin. There are many misconceptions about eczema though. The biggest being that eczema is passed from person to person and is contagious, which is completely false.
This disorder is called acne vulgaris. A lot of you may be familiar with this disorder because you probably experienced it during puberty. You could even say that this disorder has caused you a lot of emotional distress. But don't worry, you're not alone. 60,000 Americans, like myself, have experienced this disorder. Acne is caused by a bacterial infection of the sebaceous glands. This causes the oil to become infected, which would inflame the skin. Some symptoms you could find from acne are pimples, lesions, blackheads, and whiteheads. To get rid of your breakouts, you can maintain your personal hygiene as well as use varying concentrations of salicylic acid or benzoyl peroxide solutions. But it can take about 6 months to fully get rid of your breakouts. But when they're finally gone, you can proudly say that you have got rid of your acne. However, breakouts usually disappear during your mid-20s. Until then, don't pick on your pimples, otherwise this can happen.
So, warts. It is caused by the human papillomavirus, also called HPV. There are different types of warts: the common wart, foot warts, flat warts, filiform warts, and genital warts. They all show one common system, which is that they all show a small fleshy bump on the skin. Warts can be spread by skin-to-skin contact, and the most common warts is genital warts. And this leads to my conclusion to check yourself, check your partner, wear a condom.
Are you tired of your skin color and want to make yourself lighter like Michael Jackson? Well, now your dreams can finally come true thanks to vitiligo. Vitiligo is a skin disorder that affects 1 to 2% of the world's population. Light patches of skin appear when the melanocytes, or the cells that produce skin pigmentation, either die or stop functioning. Many think that this disease is associated with autoimmune diseases, hereditary disorders, sun or chemical exposure. There's no treatment for vitiligo, but Photochemotherapy and certain creams such as corticosteroids can help regain some skin pigmentation. So if you really want to follow your dreams, make sure that vitiligo is something that you really want because there's no cure for this disease.
Do you have a weird, flat, raised, and uneven lesion on your skin and you swear that it's not acne?
Or maybe even a weird looking mole that just keeps changing.
If you do, you may have either basal cell carcinoma or melanoma.
Basal cell carcinoma and melanoma are both skin cancers caused by long-term exposure to UV radiation from the sun or tanning beds.
The difference between these two cancers is where the mutation that causes a cancer occurs. In basal cell carcinoma, the mutation occurs at the bottom of the epidermis near the basal cells.
While the mutation that causes melanoma occurs in the melanocytes, which are located in the dermis.
The major factors that increase the risk of developing one of these cancers are being fair-skinned,
Spending long periods of time outside without using sunscreen,
consistent usage of tanning beds.
and finally being over the age of 50.
Pretty much if you look like our president Donald Trump, you have a higher risk of developing skin cancer.
Luckily, these skin cancers are fairly easy to treat, and the 5-year survival rate for these cancers are around 98%.
So, moral of the story, use sunscreen,
Don't use tanning beds,
don't grow old.
and don't be white.
Tip number 1, use sunblock, stay in the shade, and wear protective clothing that keeps you away from the sun. Tip number 2, don't smoke. It causes wrinkles, decreases blood flow, and damages connective tissues in your skin.
Tip number 3 would be to treat your skin gently. Use less skin products such as makeup and deodorants. Pat dry your skin after showers. Moisturize your skin and avoid strong soap. Tip number 4 would be to eat healthy, such as eating food that are rich in vitamin C and to stay hydrated.
Last but not least, you should be able to manage your stress because stress tires out your cells. You need to get a sufficient amount of rest and stay positive. The skin is the first thing that stands between us and pathogens. We can't maintain homeostasis without the skin, which is why it's important for us to take care of it. Don't wait for a pimple or a lesion to show up. Listen to your doctor when he says, prevention is better than a cure.